us today. It's an exciting day. We're going to be talking about housing. Okay, so I'll start with the ground rules. Thank you everyone for joining us. Please follow these ground rules for our virtual meeting. Everyone will be muted throughout the session. We hope to have time after each speaker for a few questions. You can use the chat feature down below to type your questions, and we will answer as many as we can. Sometimes we have to move on to the next speaker for time, but we'll get to an answer for you. Sign language interpreters are provided at this meeting. If you need assistance accessing the interpreter, please put your request in the chat. Speakers, please say your name before you speak to help with accessibility. Auto captioning is provided. You may turn captioning on or off. Click on the caret symbol next to the CC Live transcript button if you want to hide subtitles or to view the full transcript. At the top of your video screen, you can choose between speaker view or gallery view, whichever you prefer. Okay, so one big announcement is that all upcoming meetings, or the next upcoming meeting, will be a hybrid meeting. And thanks to Independence First for once again hosting the Mental Health Task Force meetings beginning the 11th of July. The only thing I want to add to that is since it will be the first hybrid meeting of the Mental Health Task Force, there may be some technical considerations we want to just iron out at that first meeting. So please be patient with us if there are any technological glitches. I don't have a lot of technical expertise. But volunteers are needed for our next Karen Avery Forum is coming up this fall. And we need volunteers for the Karen Avery Forum Planning Committee. This year's forum will focus on how to address housing needs. And interested in helping, email Barbara Beckert, and her email, if you could put that in the chat once again, if you don't know her email, you've probably seen it before. And I'm hoping that our housing presentation, our speakers today will kind of rouse some interest from our task force members so that after today, you'll be inspired to join our planning committee. Meeting materials are posted on our website at the link, and I believe Barbara posted the link below, the Milwaukee Mental Health Task Force.org link. So I believe there'll be meeting materials and maybe even a slide deck in there today. Now, thank you. I'm going to see where we're going to start on our agenda today. I'll see if our first speaker is here, and if she's not here, we'll start with our second speaker. Maudwella Kirkendoll, are you here today? I want to make sure I don't miss you. Okay, community advocates? No. When we were starting this meeting out, I heard someone saying, and I'm sorry if I don't know who said it, I'm assuming it's our third speaker, Emily, I'm assuming that was you that said it, that you could possibly switch places.
That was me. Needed. Yes, I'm happy to do that, if that makes sense.
There you are. Thank you. Let me check one more time, going once, going twice. Yeah, why don't we do that? No one wants to sit here with dead air and I can't fill it. So let me introduce you properly, Emily, okay?
Thank you.
So Impact is a longtime member of the Mental Health Task Force and an important resource on housing policy, as well as the coordinated entry system. So without further ado, let me introduce Emily Kenney, Director of System Change to the Mental Health Task Force.
Thank you. So I am Emily Kenney, and my title now is Director of Systems Change. I came to Impact as the Coordinated Entry Program Coordinator 7 years ago, and have been responsible for kind of overseeing how we implement coordinated entry in Milwaukee County. I've also added now Impact Connect to the hats that I wear. I'm not going to talk about that today, but it is I think a pretty cool new network where we're trying to connect agencies and sectors through shared leadership and shared technology. So if you're a little bit interested in that, feel free to connect with me on that. But I know today's focused on housing. And I could talk about, I have a presentation prepared to talk about coordinated entry, the process, how you might access it. And then I'm also open for questions. I will, oh, I cannot share my screen though.
I'm just
That's what
gonna
it is.
set you up, Emily. Sorry.
Perfect. Thank you.
Was
So I'll just, while Barbara's doing that, I'll just say that housing is one of the top needs that we know from Impact 211 numbers. I'm sure that you all have experienced that as well. And it's also one of the most complex systems that we've got. And so I'll start with that question. People can maybe put stuff in the chat. We're talking about housing today. Why is housing so hard? Do folks have ideas?
This is Barbara. You know, I think, first of all, people have limited financial resources and the cost for housing continues to go up. But yeah, please put things in the chat as well or speak up.
Becoming increasingly expensive, lack of available options in the community. There is a real gap between, you know, what people earn through employment or SSI or SSDI benefits and then what the cost of living really is. We talk about this housing as a system, but I would, oh, thank you. And Barbara adds the landlords who do not honor tenant rights. So that's certainly that landlord tenant relationship is part of people having stable housing and having background issues, either evictions or felonies, keeping people away from or making it harder for people to rent. And not enough low-income housing. These are all really good. Amy points out that in addition to the kind of background stuff, having mental health or substance use present in your life might impede your ability to keep stable housing. And that eviction history, Sarah adds. These are all really good. And so we talk about this the system of housing, and I would posit that it is not one system, which makes it even more complex to access, because there are, you know, housing as a term, there are multiple different doors for housing, whether you're a homeowner, so that's something that I'm not going to talk about at all today, or you're renting, and then different types of ways that the government is supporting housing, mostly the government, sometimes others step in. And as we've pointed out, many people do not have the funds themselves to be able to fully afford housing. And yet it is not an entitlement. So even though we've acknowledged that there is this gap between what people make and the cost of living, especially rent, we do not have in this country the idea that housing is something that everybody gets. I should check this statistic because it's pretty old now, but at one point, the statistic was that only 25% of the people that would be eligible for Section 8 based on their income get it. So there's a gap of, you know, 3/4 of the people that are living in extremely low income and would qualify for Section 8 that don't have that available to them because we have not, that's not seen as an entitlement. Something that is seen as an entitlement now is Medicaid, for example. So as long as you have that that asset testing about income and other assets, at least at the moment, then you would be able to get Medicaid. And so we don't have something like that with low income housing in our country. And to further complicate things, we have additional complex eligibility requirements depending on which door you're going into for housing. So in summary, it's hard because we've set up these multiple systems that make it hard it's not streamlined. And so it's on service providers really often to kind of help people navigate through these multiple systems. And I'm going to talk about one of them, one of the doors. I will mention a couple of the others, and I have some knowledge of some other systems, so I can talk about that for what I know. But I will say that I am not an expert on all of the doors of housing. Coordinated entry is the system for people experiencing homelessness to get referred into potential housing options that are paid for by HUD, specifically for people experiencing homelessness. So this system that we've set up is a mandated system by HUD. No matter which community you go to in the United States, there will be some kind of coordinated entry system. It may not look exactly like this, but there is a mandate that a system like this exists. And the reason is that HUD realized that there were more people in need than resources, and they wanted to make sure that people that were most in need were able to get those resources first. So the mandate has kind of two pieces. One is that housing that is funded by specific funding streams have to receive referrals from this system so that there's housing to refer into. And the other is what we use as the system. So we have to figure out how to identify everyone experiencing homelessness, assess them, use that assessment to prioritize people, and then refer them into potential housing options. So what do we need to make it work? So we have to have broad, diverse partnerships to identify people in need. So hopefully, if you are not familiar with this and you are not already helping us to identify somebody in need, we could talk after, because we need everybody to be helping us identify somebody who might be in need of housing services. We recognize that not everybody is going to, when we first started coordinated entry, gosh, it was before I was at Impact. It's been 10 years now. That's astounding. So 10 years ago, we had, everybody was calling 211, and that was the entry point. And that's still true, but we recognize that people might not call 211 for a variety of reasons. And if we can use the relationships that people are creating in the community and use that to identify people, we're actually better at fully identifying the need, if that makes sense, instead of depending on people to self-select in. But as we have this broad, diverse, identification, in order for us to be able to prioritize and refer, we have to have a centralized management of the list, the prioritization list. And so that is done at Impact by the team that I oversee there. And we need to have housing to refer people into. So that's probably the most frustrating part about this, is that, we use the information of the people, of the number of people that are identified to advocate for more housing options and solutions. But if we don't have the resources in the community to refer to, I think sometimes we can feel a little bit stuck. All of us can. So the other piece that I like to talk about when I talk about coordinated entry is that we used to have, when we first started, this idea of, and it wasn't overt, we weren't stating it like this, but the messaging that we were giving by the process that we used was, help starts with shelter. So come into shelter first, and then we will figure out housing from there. But the problem with that is that there already isn't enough shelter for everybody who is experiencing homelessness outdoors. And shelter isn't solving the problem. The problem is that the person is calling in because they need stable housing. And so I had heard this parable, and you may have heard it too, of you know, you're out with your friends sitting by a river, and all of a sudden you notice that babies are floating down the river, sputtering down the river is maybe more like it. And so you jump in and you save that baby, and you perform CPR, and you make sure that the baby's okay, and get the baby back home. And just as you're sitting down, there's another one coming, and another one, and another one. And pretty soon you have this whole team of people that are in the river poised to catch babies. You have people on the shore ready to, with blankets ready to help. You have the paramedics standing by. You've got, volunteers bringing food for people so that they can really kind of work all hours, until someone says, why are they in the river in the first place? And let's go upstream and figure out how we can stop them from coming into the river. And that has stuck with me with how we think about, or at least how we used to. We're changing now. How we used to think about solving homelessness. We were continuing to increase the team at the bottom of the river. Shelters certainly was part of that. And we couldn't keep up as more and more people were kind of coming in. I'm sure that most of you have heard about Housing First and the Housing First model of ending homelessness, which is to focus on housing people and then wrapping services around them in order to help them stabilize and keep the place that they're housing, their apartment. And we know from developmental psychology and how we all kind of work through in our lives, that having that safety of your basic needs being met help you then think about the other pieces of your life. And that really it's impossible physically through the way that our brain works. It is impossible to focus on some of those other things like getting a job, or increasing income, or increasing sobriety, increasing wellness, if you don't have your basic needs met. And so Housing First really came to say, let's house people right away, and then we can wrap services around them. That model is still expanding services at the bottom of the river. That model is still for people that are, have already been through all of the trauma of all of the, different housing situations, probably lived somewhere paying rent, probably then became doubled up, maybe did self-pay in a hotel or something, until really kind of lost everything and now are on the street or in shelter. So as we start to push, part of what coordinated entry is trying to do certainly is use best practices that work, so that we're able to fully get those babies out of the river and they don't come back, right? So end people's homelessness and help them remain stable. But also we've got to start working our way up the river. And so coordinated entry and our system no longer starts at shelter. We want to be able to help people before that. And we want to be able to offer housing solutions and problem solve around housing wherever they're at. So still we'll get often calls saying, I need shelter. And I think that is because we have said for so many years, help starts at shelter. So one of the big takeaways I hope that you all have is that help can start before shelter, but we've got to be a little bit more creative, and we've got to work in partnership to do that. So one of the ways that you all can help is, I said that coordinated entry was for people experiencing homelessness. So part of the challenge is that this is one of the doors. There are other doors that you could potentially walk through. And I just want to encourage everybody to think about, is there a way that you can help somebody work through that housing crisis before even calling us? So kind of even more upstream. Is there a way that a person can use natural supports for a little bit longer? Can we salvage a doubled up situation? Is there a way to kind of work through whatever happened there where they're potentially being asked to leave? And there are really 3 pillars for stable housing, whether you're doing that from like a tenuous situation, or you're doing it from shelter or from the street. or the person is in a housing program. It's figuring out what type of housing do you need, and also how will you pay for it? So maybe there are some other doors that you could explore there. What kind of income are you going to be able to use? And everyone needs an income plan. I've always said, even if the person is subsidized, has subsidized housing and has, you know, food share and case management, they still can't pay for toilet paper unless they have cash, right? So income is important for everybody. And support. So if you are that person's support person, perhaps you can work toward independent or general housing that way. I'm sorry, just 1 minute. Sorry about that. My son just came into the room very loudly. Okay, so the other resource that I'm hoping that Maudwella will be able to talk about a little bit more in depth is that since like really in the pandemic, we launched this rental housing resource center that is the triage center is housed at Community Advocates. And the model is 9 co-partners coming together to reduce evictions. So this is a great resource. So maybe you've tried this kind of, you're way upstream here, but you still need some help. You couldn't salvage those situations, can't figure out, kind of an immediate income plan, and you're going to need a little bit more help. The Rental Housing Resource Center, if the person is renting in some capacity, even if they've got an eviction, that resource center has resources to help hopefully keep people from fully being evicted and out. But if not, also is able to connect up to coordinated entry if they do become homeless. So what's new, and so I'm talking about the kind of pre-CE. I have presented, I can't remember the last time I was before this group, but I think we were in person. So it's probably been a few years now. So since I last presented to this group, we have been talking about all this prevention work, and we have really bolstered our prevention partners to be able to refer to case management resources before the person is in shelter or outside. We also are including safe havens now. So for people that are literally outside and are their mental health symptoms are presenting a barrier to like general shelter, safe havens are an option for them. So we've integrated those into our coordinated entry process. We also, I'm very excited about this. I talked about one of the pieces that we need is to have enough housing options to refer into. And in the last few years, we have gotten healthcare partners, both plans and health systems to step into this space and help give funding for people that need housing and are also interacting with the health systems. It's not enough to house everybody, but it's more than we had before. And I'm really excited about the partnerships and where they're going to go. We have also recently from HUD gotten two specific programs for people experiencing homelessness due to fleeing violence. So we are continually expanding and trying to get more of those options for housing so that it's not only kind of warehousing a list of names of people in need with nowhere to refer them to. And we're continuing to add those intake partners that are able to identify people and say, this person is in need, how can we help them? So I want to talk now about what the process is and how you might interact with us. So these are some of the nuts and bolts of really what this process looks like, and want to make sure that I can answer questions about anything I've said as well. So the first step is identification. So people can still call 211. What will happen when you call 211 is they will figure out what is the resource. Are you like way up here upstream? Are you Rental Housing Resource Center upstream, or are you kind of coordinated entry? So they're going to identify that and refer them to that resource. So 211 is not going to place people in shelter. They're not going to find an apartment for them, right? But they will refer to that next best step, that agency that's going to help them at kind of wherever they're at along their journey down the river. We have a really good relationship with our street outreach teams. And so they work with us every day, letting us know who they might have, if they've identified someone who is outdoors, and connect them to our system for housing and potentially shelter or safe haven. We have a walk-in site for anybody who's interested in seeing somebody in person. Right now, those hours are listed. We're at Repairs of the Breach from 9 to 11 and St. Ben's from 1 to 4, Monday, Wednesday, and Friday. Or we can receive a referral from a partner like you all. So you can email us is sometimes the easiest, because then we can kind of have this back and forth and be able to connect with each other that way. Unless you're on Impact Connect, that other hat that I wear, and then you can use Impact Connect to refer to us. We have a professionals only line to call in and kind of case conference with us. And if you're interested in becoming a partner in this capacity, please email me so we can chat more about what that looks like. So that's how we identify people who are in need. And then we complete an assessment based on their situation, if this is homelessness prevention or if they're already literally homeless, and the type of assessment that we would complete. We use those assessment tools then to inform our prioritization. So this is the current prioritization for the funding streams that we have. We're working through approving our policy for those 2 funding streams for people fleeing violence. This is not just something that Emily makes up. The process for creating our prioritization is done in committee so that we have broad input from providers, from people that are impacted by homelessness, and then ultimately it goes up through our governing bodies, the different committees that we have, and then the Continuum of Care Board, that is our governing body. So it's a process to create a new prioritization, and it's not taken lightly. Really what we have in mind when we're thinking about prioritization is who needs these resources most, who needs them first. And so that's how we've come up with this. So we come up with that prioritization generates a list of people kind of in that order based on the assessment and the prioritization criteria we've set, but that's not where we stop. So we know that that's a nice, pretty little list of people in order. We know that that is not the reality of people's lives. People's situations can change. There can be urgent situations that come up. And so we have staffings in order to create placement, who we're going to refer, decide on who we're going to refer. So that is also done very collaboratively. So in that staffing, we have the providers, so like the housing providers at the table, and the case managers or outreach workers that are working with that person to be able to speak on their behalf in terms of what they might want or need. And then we're able to, we use that list as kind of our backbone, but that's also, there's an opportunity for people to say, look, I know that this person might be further down on the list, but there's this extenuating circumstance, and can we staff them about what are we going to do? We need to do something. So there's room for kind of going off the list. When we prioritize somebody who isn't based on that prioritization that we've set and the report, there needs to be a consensus among the group that we are kind of doing that out of order. We also recognize that once someone is in their first placement, that might not be their last placement for a variety of reasons. So we have every other week a transfer meeting where we can discuss, people can bring by and say, hey, look, this person is really struggling in this placement. We need to figure out a better fit. Or we can also move people on to a different door. So we have because of COVID funds that required some of the Section 8 vouchers to go to people experiencing homelessness. That door, there's now like imagine the adjoining hotel rooms, there's like that side door where we could kind of go between rooms. So we use that meeting to be able to say, this person is doing great. They had permanent supportive housing, but they don't really need that level of support anymore. They still need a subsidy. Can we give them a Section 8 voucher? So we use that meeting to be able to discuss that. For housing staffings, we do these about every other week, depending on the type of funding and the type that, like the population that the housing is focused on. For shelter, we do these staffings every weekday, Monday through Friday. And then for safe havens, we do them as openings come up. So my team is facilitating these staffings every day of the week. And just to make sure that folks kind of understand the process. So that's great. We decided who we're going to refer. And all of this is HUD, which means that there is paperwork that is required for compliance reasons for the funding. So there is next a process of getting that paperwork completed, potentially finding a landlord if it's a voucher, having the landlord sign off on that paperwork. So as much as I would love for the person to be housed that day, that's pretty rare. There's usually a couple more weeks of paperwork, finding an apartment, that kind of thing until the person is housed. And just a note here, some of these bullet points go through when we would remove somebody from the list. And we really try our best to be in contact with people. And even if they decline and say, I know that I was up for that housing, but I don't need housing, I don't want it, that we persist and ask them, offer in different ways for at least 6 months before we remove people. And people can always be re-added. So I think one of the hardest parts about this whole conversation about who's on the list and who isn't, this is not a chronological list. So if you go off of it and then you come back on, and your vulnerability in terms of your answers to that assessment and the characteristics that might make you more vulnerable, if those are the same, you would go back relative to others, and that's where you were before. So you don't get bumped to the end just because we couldn't get in contact with you, or because for whatever reason you were declining housing. You can always be re-added, and then you'd be kind of reprioritized. I heard somebody recently liken this system to like what we try to do in emergency room triage. And that is very much what it feels like. So we're every day kind of trying to figure out who is most in need that we're going to be working with first. And our goal is to get to everybody eventually. I will say one more thing about that before I go on to the programs, just so folks can see that. We also, part of our coordinated entry system is to work, bring people together around, we call them macro meetings. So we have this process for the individuals, and then we evaluate that process and set goals for really reducing the number of people in any kind of demographic that are experiencing homelessness. And this process ought to be working toward those goals. If it's not, we're not doing it right. So the goal of coordinated entry really is to have a process for eventually ending homelessness. So an example of that is that we've worked with United Way and their Safe and Stable Homes initiative to end family homelessness. And we're looking at that every month, kind of how many families are coming in, how many families did we provide with homelessness prevention and they have not come into the shelter system, how quickly are we rehousing families, and overall, is that number of families experiencing homelessness going down? So we do that work as well and adjust our process if we find that something, the numbers aren't going down. That means we're not being effective. So this is a list of, and I believe you all have these slides, this is a list of the programs that come through coordinated entry. So folks that have been around for a while, My Home is a county program, and we still get calls directly to the county, and then they re-refer them to us. So just if there's a specific program that you think of, like I used to work with Project Bridge back in the day, you know, then that would be a reason to email us and say, hey, I've got this client and here's the situation. And I was thinking Project Bridge. We can't guarantee that we'll give a referral, but at least we can get them into the system then, and potentially refer them after that. So there are programs that do not come through coordinated entry. So the Rescue Mission and Joy House, those shelters do not come through coordinated entry. Neither yet do the domestic violence shelters, Sojourner and Milwaukee Women's Center. Salvation Army Medical Respite does not come through us. And then a lot of the county programs. So if you've heard of community intervention housing, the general Section 8 and Housing Authority, the Section 42 elderly and disabled subsidized housing that you would apply for at each of those buildings, you would still do that through those buildings. And then I can't say new funding streams anymore because now they're sunsetting, but kind of the COVID prevention and ERA, those funds do not come through coordinated entry. So this is just that a summary slide for how you connect with us. You can call 211 or you can call our professionals only line. A reminder to contact the Rental Housing Resource Center first if the person that you're working with or you are facing eviction. Our email, the walk-in hours, and then contacting me directly to talk further about how we might be able to partner.
Thank you so much.
There's so much in the chat I've not looked at. So
we've got you're almost at time, but we should get to the questions. I'll read the first one. Yikes. Is this strictly for Milwaukee County, or does each county have their own programs?
This is strictly for Milwaukee County. So yes, you would, yep. If you're not in Milwaukee County, you could check out the HUD. I'll put it in the chat. There's a HUD site for where you can find the continuum of care of that county.
Okay, please check out the slides on your slides on the Mental Health Task Force website, and Rachel Schwerin also put a link in the chat. Are there efforts to expand coordinated entry to include other programs?
So, and Barbara, are you talking about like in addition to specific funds around homelessness, or what kinds of other programs are you thinking?
Well, you listed a number of the programs that aren't included currently, so
yes,
that was forever.
So we are, yeah. So we are working actually really closely with the DV shelters right now to figure out how we can better connect to each other. And perhaps there will be a coordinated entry process. I don't know yet what that will look like, but certainly we're working on that. And yes, I would say with County Section 8, we've gotten some traction about how we can better partner. Probably not fully coming through, meaning that the only way you could access it would be through coordinated entry, but our system needs access to kind of all of those different housing options. Otherwise, people get frustrated. So we're trying to yes, bring more folks into our group. Yes, Barbara.
I had one more question, Emily, and you might not have the answer right now, but we would appreciate your perspective on it. The Mental Health Task Force has been talking about having our annual Karen Avery Forum in the fall focused on housing. And we were really interested in identifying, some models that may have worked in other parts of the country that we could learn about that might help to increase access to affordable, accessible housing. And I know you do a lot of policy work. So first of all, we'd love to have your help with it, but also would value any ideas or suggestions you might have for speakers and topics. So, again, leaving the door open, not to put you on the spot right now.
Yeah. I would be happy to help out with that. And let me think on that and do some asking around. Yes.
Wonderful. We really appreciate it.
Mary. Hi, Mary.
Hey, Emily, I just have a quick question. You said you you look at and you do some evaluation to make sure that the programs are working and doing the things macroly as what they are intended. What do you do with the Housing First program?
The Milwaukee County Housing First program.
Mhm.
So, yeah, so
From an evaluative perspective.
yeah. So we don't, coordinated entry doesn't look at kind of like each individual program, but it's more kind of like on the whole, how are we doing? And so what I will say is that each program is required to, that is required to, I should say. If they are required to work with us, then they are required to be low barrier, meaning that they accept referrals without looking at those background things and, you know, counting people out because of, you know, anything really.
Right.
And then our, what we are working on as a system as a whole, I think, is figuring out how we effectively support people in housing. So Housing First is those two pieces, low barrier entry, which I think we are pretty good at as a
Right.
community. But then supporting people fully, we need more support, and it needs to be beyond just case management to be able to support people fully. So that's one of the things that we've seen, is that once people get in, some of the challenges and having to rehouse people, we think is because we don't have all the resources that we need to support them in their apartment. So that's something that we're working on.
Okay.
So we don't evaluate, like, I'm
Right.
wouldn't be prepared to say like this program performs at this level.
Right. You
That's
just
not,
do a
but like
cursory
as a whole.
review of what's happening.
Yes,
Okay,
yes,
thank you.
sure.
Any other chat questions in the chat, Barbara? Or Christine?
No, I was just gonna say thank you and turn it over to you, Mary. Thank you so much, Emily.
Yeah, thank you. I just put my email in the chat once again. If you want to connect offline, I'd love to talk further.
Thank you, Emily. Excellent as usual. All right, I'd like to welcome our next speaker, and our next speaker is Maudwella Kirkendoll. He is the Chief Operating Officer and Director of Basic Needs Division at Community Advocates. Welcome. Good to have you here with us today.
Thank you. I appreciate the opportunity. Can you guys hear me okay?
I can.
Okay, good. Again, as mentioned, my name is Maudwella Kirkendoll. I am the Chief Operating Officer here at Community Advocates. I've been here for about 24 years and have provided services in pretty much all the areas in Community Advocates, from housing to healthcare to shelter services. Today, I'm going to talk primarily about our housing division, our housing programs, and then I'll also touch on our the Rental Housing Resource Center, which is a collaboration of many partners, roughly 9 or 10 partners. Excuse me. First program I'd like to talk about briefly is our rent abatement and rent withholding program. So again, when I started here at Community Advocates, my first job was to be a housing advocate in a rent abatement program. In that program, we work very closely with the City of Milwaukee building inspectors, police department, to essentially either force landlords to comply with code violation issues. Typically, we refer individuals who call our office looking for repair issues to DNS. DNS in turn will essentially write orders on the property, and once the orders are written on the property, we can move forward with helping the tenant legally withhold a portion or all of their rent, depending on the situation. Primarily, it's a portion of the rent, but then there's also withholding that we can do where the tenant will pay the balance of the rent to the City of Milwaukee and place that in the escrow account. Once that money is placed in an escrow account and there's enough funding in the account, we are able to actually hire licensed contractors to go in to make repairs on those particular properties. What we found just over time is that a lot of the evictions that were happening, a lot of the evictions that were started were done so because there were a lot of repair issues within properties, and tenants decided that they would, on their own, withhold rent. And the law does allow them to legally withhold a portion of the rent based upon a state statute that we have here, but oftentimes they would abate or withhold too much of the rent. That wouldn't, it basically the repairs and the amount that was withheld wasn't justified. And then the courts would have no recourse but to grant the eviction. 99% of the time, if they are working with us and we have all the facts on the case and we do rent withholding, rent abatement, the tenant is safe and they do not fear eviction or retaliatory evictions from the landlord. One of the other programs we have, and I'll talk about emergency rental assistance. So community advocates along with Milwaukee County and Hope House administered the Wisconsin Emergency Rental Assistance Program. We did that for Milwaukee County, as well as the city of Milwaukee, as well as Waukesha. And so individuals and families that were impacted by either COVID specifically, or they had a hardship during the COVID period, we were able to provide rental assistance to the tune of essentially 18 months for each household, if they were eligible during that entire time frame. We didn't, there was no necessarily rent caps. Essentially, if you met the income guidelines, which were relatively high, and you had a financial hardship, we were able to provide financial assistance for those families. And over the course of 3 years, we've administered roughly $80 million in the Milwaukee community. The bad news is that program is coming to an end soon. So there will be a press release today going out notifying the community that as of June 20th, which will be next week, we will no longer be taking new applications for rental assistance for that particular program. So if you have individuals that are in need of assistance or maybe in need of assistance, not sure if they're eligible, you want to make sure they get an application in our queue before June 20th. Any applications in our queue will be processed accordingly. If they're eligible for assistance, we do have the financial means to pay those out. Once we get through this large queue, there may be an opportunity to reopen the application portal, but as of right now, as it stands, we will not be, after June 20th, will not be taking any new applications for that program. With that program, just so you guys are aware, we were able to pay future rent, rental arrears, utility bills, water bills, fees that were associated to the housing situation, pet fees and things of that nature. So we were able to pay those for up to 18 months for each household if they were eligible. The smaller program that we have, so once that program goes away, the other financial assistance program that we have would be our homeless prevention program. It's drastically different in that we can pay a maximum of $1,000 per household. So essentially, if a family has a loss, family or individual has a loss of income of some sort, reduction of hours, lost their Social Security benefit, or it was put on hold for whatever reason, they can apply for our homeless prevention program. And to do so, they can simply come into the office and fill out the application. Again, we would maximum that we can pay for that particular program was $1,000. If we see individuals coming in regularly, excuse me, we also have a program where we can link them with the case management services. We have roughly 6 case managers that provide case management services. They also have access to a limited amount of funding to provide things such as future rent, past current rent. Maybe it's an issue with furnishings or appliances. We can assist with those things as well. So that would be through our homeless prevention program as well as our SEMER program. And again, for the SEMER program, it's primarily families with children. So they have to have school-aged children in those programs. And that for that particular program, homeless prevention could be, anyone can utilize that program provided they have a loss of income. And then also what we look for is to make sure that once we provide that financial assistance, those individuals will be able to maintain housing afterwards. So it's not a program where we're just going to pay one month's rent and then not know if that's going to stabilize your housing situation. The ultimate goal is to stabilize homes. Excuse me. We also have a program where individuals are maybe leaving shelter and are in need of case management services. I know for our shelter specifically, we don't necessarily follow the families once they leave our facility. So one of the things we're able to do is link them with one of our case managers at the downtown location, and they'll work with that family for 6 months, very similar to the SEMER program. And sometimes we enroll in the SEMER program and those individuals will get that intensive case management. And one of the things we do, we don't look at just servicing providing services to the mom. We look at it from a multi-generational approach. So we do work with the mom, kid. If there's a grandma in the house, we work with the entire household. With the youth, if there are kids in the household and maybe they're having issues and they need mentoring, tutoring, having trouble with attendance or things of that nature, we work very closely with the entire household, the child, and make sure they have the resources they need so that they can be stable in the house, but also stable in their education. One of our long-standing programs is our Security Deposit Guarantee Program. It's been around for 20 plus years. And primarily what this program does is allows individuals who are not able to afford to pay their rent and security deposit when they move into a new place to simply pay the rent, and then we set up a payment plan so that you can pay the security deposit over a 4 to 6 month time period. Because of all the funding that's been out there because of COVID, there hasn't been like this wide usage of the program, but since funding is starting to decrease and people have maxed out the ERA program, we do see an uptick in this program. So if you have individuals who maybe they have evictions on their records, recent evictions, or just have poor credit, things of that nature, we do have landlords that specifically work with this program that would allow these tenants to move in by simply just paying the first month's rent and then that payment arrangement for that security deposit over that 4 to 6 month time period. Community advocates comes into play because we'll actually draft a document, a contract between the tenant and the landlord and community advocates. And then of course, if the tenant does not pay the contract, community advocates we basically are on the hook for that balance, and we do pay the balance of the security deposit to the landlord directly. We have a list of landlords that work with that program. So if you have individuals that are looking for housing, they could come down to the office here, 728 North James Lavelle, and get that listing, and then also a copy of the contract that they can take to the landlord that will show how the contract works and what their payment arrangement would be. Let's see here. And then one of the other things that we've done for some time now is tenant landlord training. So we developed a training called Tenant Landlord Rights and Responsibilities. And so this is something we do primarily in shelter systems, W-2 agencies. We've done them at the libraries and things of that nature. Work very closely with the City of Milwaukee's training program as well. But again, it just walks tenants and landlords through, primarily tenants, but through, how to look for a place, things to look for when you actually are renting, the inspection process when you're moving in, the move out process. There's a checkout list that's provided, and all of the resources that are available to a tenant when there are issues like need repairs on a property. If landlord's not compliant, what do you do? Just kind of walking them through the process so they don't make a bad decision and end up evicted simply because they just don't know what resources are out there in the community. That tenant training has been promoted by landlords, and sometimes we have landlords who send their tenants our way. And again, the goal of that is to give them the resources they need so they are successful tenants, and of course, stabilize the family and the household. Emily mentioned the Rental Housing Resource Center. Again, that was something that it's been in the works for, 4 or 5 years. There were probably 60 groups at the table when we started talking about this. And at some point in time, probably pre-pandemic, we were supposed to open up, and literally once the pandemic hit, we had to shift into gear where we were just looking at providing financial resources. So majority of the time over the last 2 years, we've been utilizing our triage staff in the Rental Housing Resource Center to provide financial relief for families that were being evicted. But ultimately, what we're going to be doing, and we've started already now, is looking at more mainstream resources around housing. So again, linking folks to landlords that will work with tenants that have evictions, for example. And if you go to our website, I'm sorry, it kind of provides some very helpful tips for tenants as well as landlords. So you can go there and then it'll ask you what your situation is. And we've tried to make this as simple as possible. So someone can go there and say, hey, I need help resolving an issue with my landlord. And they click the box. Once they click the box, there's other drop downs that may come in and it'll say, my rental unit has maintenance issues and they've gone unrepaired, or I have communication issues with my landlord, or my landlord has violated my lease. You can click that box, and then the next drop down will give you a list of resources. So I selected my unit has maintenance issues. And basically what it does, it walks you through what you should do, who the contact person is to get things addressed, and then a list of phone numbers. So for repair issues, we list Mediate Wisconsin, Community Advocates, because we do the rent abatement program, and then DNS, because DNS is the ultimate authority over repair related issues. And so we have that for tenants, and there's quite a few drop boxes for tenant issues. But then also, like I mentioned, we work very closely with landlords to develop the rental housing resource center. And so we have options for landlords. They can click my tenants behind them in rent. They want to apply for rental assistance, and it'll give them, again, a list of options and resources for those individuals, which include a link directly to our rental application for individuals that are being evicted because of rental, not being able to pay their rent. The Rental Housing Resource Center right now has 3 staff. Two of the staff are triage specialists, and then we have a director, which is Ravel Warren. She recently started. But if you have any like tenant landlord issue, or you have individuals that are saying, okay, I'm behind my rent, I'm having issues with my landlord, they simply can go to our website, or they actually can walk in. And we don't turn anyone away, so they can see someone between the hours of 11 and 3 o'clock, and they will work with that individual to resolve that issue. And again, it can be anything from, I have issues with my next door neighbor and I just need some mediation help, or I'm in a situation, I don't know what to do. Can you just provide me with some guidance? We can work with those individuals. And I mentioned we work with landlords. The Apartment Association of Southeastern Wisconsin has been great. Again, we spent a couple of years working to develop some of this stuff. And one of the things we realized that we can't move the needle without the landlords being part of the process. And so they've been here every step of the way. And not that it's always been, that we agree on items, agree on things, but we definitely collaborated and came in with the best product for the tenants. Because ultimately what we realize is like us, the landlords don't want to evict because it's costly. And for us, when tenants move, it's costly for them. So we've worked very closely to figure out how do we work collaboratively so that we don't have, we reduce the number of evictions that take place. One of the agencies that I have to give credit for is UWITA. They basically kind of set the stage for the Rental Housing Resource Center and provides a lot of backup for us. I think it's critical that we continue these collaborations, like opportunities where we can kind of talk about some of the work that we're doing is always critical, and we're always willing to come and kind of talk about what we're doing, and some of the policy work that we're doing around domestic violence and things of that nature will be kind of spearheaded out of the Rental Housing Resource Center. Excuse me. Again, I mentioned all our partners and some of the resources that are available. Again, we provide assistance if someone they have no income. The Rental Housing Resource Center can link them with like food share employment, W-2. If we have individuals that have needs for job leads, we actually get those in the Rental Housing Resource Center. So we really want to become that one-stop shop. But the other added benefit is individuals who are homeless. And again, as Emily mentioned, Impact is here. They have hours here in our location. Legal aid staffing is here. So really, when people come in, we don't want to send them away. And that we've been kind of forced to be able to do so, whether it be looking for an attorney, or again, if they're homeless and looking for either shelter space or some mediation of some sort, or homeless prevention services of some sort. We really want to be that one-stop shop for those individuals. And then again, we still have that close partnership with Social Development Commission. They're currently providing financial resources for individuals that are in the city of Milwaukee. I mentioned that community advocates will be, Milwaukee County Community Advocates will no longer have funding applications after June 20th. Social Development Commission will continue to process applications until further notice. One key thing is that if an individual came to community advocates and we process their application, essentially have to stay with community advocates. It's the same pot of money, same regulations and things of that nature. So we just want to make a note of that. So again, if you have individuals that have any tenant landlord related issues, the Rental Housing Resource Center is open to the public, and we have staff there that will assist with any tenant landlord issue. And if we are not able to do it in-house, we will definitely make referrals to the appropriate parties so that the issue is going to be resolved. I think that's all I have. There any questions?
Hi, this is Christine. I'm not sure if Mary's still here, so I can field the chat box for the questions. Can anyone attend the meeting for training for tenants? Or training for tenants?
Yeah, we can actually, again, we'll start having tenant landlord trainings here at Community Advocates as part of the Rental Housing Resource Center. So it will be open to the public. And then if you guys have if there's like a need in the community, we can actually bring the training to you guys as well.
Good. And then from Barbara, we continue to hear about difficulties for those who need assistance from Housing Authority for City of Milwaukee. What resources can help if HACM does not respond? Can the center assist?
I'm sorry, can you repeat that, please?
Sure. What resources can help? I'm sorry, this keeps moving. We continue to hear about difficulties for those who need assistance from Housing Authority for City of Milwaukee. What resources can help if HACM does not respond? Can the center assist?
Yeah, so we actually, it's kind of timely. We actually had a meeting with Housing Authority on Friday of last week, the Rental Housing Resource Center, and we had 4 of their key staff at the meeting, and we kind of talked about some of the presenting issues, because we oftentimes get individuals coming to our office primarily because they're not getting a response from HACM as it relates to whether it's recertification, changes in their rent amounts because of recalculation, things of that nature. I mean, as of right now, if individuals do have issues with HACM, feel free to refer them to the Rental Housing Resource Center. We have currently developed a direct relationship with the site-based portion, and then we have a meeting scheduled with Section 8, the voucher-based portion, coming up next week, I believe, where we'll also have a direct connection to those individuals, so we can, if there are individuals that come through our doors, we can send a referral directly over to them and get a response relatively quickly.
Thank you. From Rebecca Rabiton, is the landlord training provided in alternate languages?
Yeah, so I mean, as of right now, we have individual that there's Spanish speaking and English at this point in time.
Thank you. From Tawana Watson of Sojourner, are there specific walk-in hours during the week a person should come to Community Advocates to talk to someone about the housing prevention program or other programs?
Yep, so generally we have our Rental Housing Resource Center hours are 11 to 3 to see individuals. If someone comes outside of those hours, we will still see them. And then we also have general walk-ins for Community Advocates Housing Department. And so, yeah, they should be able to come down. I would suggest they don't come down towards the end of the day, but anytime between the hours of like 9 and 3, they'll be able to see someone in person.
Thank you. From Barbara, what resources are available for recovery housing for people recovering from an addiction who need sober housing?
You know, honestly, we don't have a lot of resources. I actually have a link that I was trying to send you guys. It won't go through, but I'll send a link to what we do have available, and you guys can pass it along to the group here. But there aren't a ton of options, to be quite honest with you.
Thank you. From Tawana again, is it possible to get your contact info to reach out to you about possibly speaking with Sojourner staff about your programming?
Sure.
Okay,
I'll put it in the chat.
thank you. Mr. Kirkendoll from Rachel Schwerin, could we have your email? Okay, email if you have any follow-up questions. Okay, so people are asking for your email address in the chat.
Yep, so I just put in the chat my
And-
email and my direct cell phone number.
Wow. Christine, this is Barbara. I just wanted to note that in response to the question about sober housing, that someone put in the chat that Oxford House has plenty of space available. So I don't know if they're willing to put the contact information for Oxford House in the chat, but it sounds like that would be a really helpful resource. So thank you for mentioning that, and hopefully we can get more detail.
Other questions for Maudwella before we pivot? Oh, from Barbara. You're on mute.
I got the information that was shared with me, so I'm going to put it in the chat about Oxford House. So, and thank you so much, Maudwella. That was really informative. Great information.
Thank you for the opportunity.
Thank you very much. Yeah, it was very informative and a great resource that we could all use, as well as our clients. Okay, now we're gonna switch over to our next speaker, and thank you, Barbara. I'm looking for him on oh, there he is. Thank you for showing your face. Okay, this is sorry. The Mental Health Task Force recognizes the legal advocacy that Legal Aid Society has provided over the years that have benefited people with mental illness, including litigation to address conditions for people with mental illness in the Milwaukee County Jail. So we were very happy to see and hear from Nick Toman from Legal Aid Society of Milwaukee. He's the managing attorney of the Housing Trust. And I'd like to say one more thing about him because he's got more of a bio. Maybe not, that was it for the bio. Anyway, without further ado, thank you so much, Mr. Attorney Toman, for being with us today.
No problem. I'm not sure I'm gonna have as much to say as the previous two speakers, definitely not as much as Emily. They have so many different programs going on. Our housing program is pretty focused at this point on the eviction-free MKE program. It is our eviction defense program. It is the goal is to provide representation to every individual in the county who is facing eviction, who has an eviction case filed against them in Milwaukee County, with the caveat that there's a 200% of the federal poverty guideline income limit on that. We have 10 or 12 attorneys at this point. There's always somebody coming and going, so it's hard to really give an exact number, but 10 or 12, the equivalent of 10 at this point, but a few more really, representing defendants in eviction actions. The eviction-free MKE program was started in late 2021 and really got up to speed in 2022. Last year, we took 3,244 cases, represented that many. Some of those are sent to legal action as a sub-grantee under the eviction-free MKE program, both as a way to spread the caseloads, but also because of legal conflicts of interest that come up. It's necessary to have a second firm to take some of those cases. This year to date, we have had 1,350, so we're on pace. I did the math, we're on pace for almost exactly the same number. It was within 4 from last year. So I don't know what that means, but it's surprisingly consistent so far. We represent tenants who have an eviction filed against them. We take cases when the eviction is what's called the first cause of action stage, which is the possession stage, the eviction part of the eviction action. We also represent people in the second and third causes of action, which are the money parts of the case, but only if we've represented them in the first cause. We don't take straight money cases because, well, they are important. We are focused on housing and homelessness and not the straight money issues. So we will follow a case all the way through to the end if there's a second and third cause of action filed, but only if we've represented people in the initial possession part of the case. Our eligibility criteria are very simple. Milwaukee County resident with a Milwaukee County case, and family has to be under 200% of the federal poverty guidelines. Our intake process is also fairly straightforward. I'm putting in the chat the website, evictionfreemke.org. There is an online intake form application that asks for the pertinent information that we need in order to run a conflicts check and keep track of clients, review them for eligibility. And so there's also a phone number. We have a team of intake specialists who will do the intake or gather the intake information over the phone if that's easier for the individual. Once that intake is submitted, they're reviewed for eligibility, assigned to an attorney, and we say to expect a call within 3 days or so. It's often faster than that. I don't want to give a hard limit on how quick or how much lead time we need before a hearing to represent somebody, because I mean, honestly, sometimes we can turn it around surprisingly fast with like a same day. Sometimes, depending on the caseload and the timing, it can take a day or two. So I don't want to give a hard limit, but the earlier we get the intake application, the better, obviously, because we do have to go through and do our due diligence on conflicts checks, ethics, review the file and everything before we are able to agree to represent somebody. Yeah, so that's the eviction free MKE program. We also have a much smaller program under safe and stable housing funding that we receive. It's just a single attorney. Well, actually, she's not licensed, so she's not technically an attorney, but she is licensed and she works directly with me. So we make sure that everything's right. But she reviews people who have received termination notices, which is there's a really big need out there for just simple advice on what to do when as a tenant receives a termination notice. It becomes especially true in situations with disabilities, in fact, because the timing and perhaps need to submit a reasonable accommodation request or to be connected with services that might help cure the alleged violation is really important and urgent. Unfortunately, we don't have the capacity to dedicate multiple attorneys to the termination notice cases. So we do have a very limited capacity to do that. Intakes for that actually should be submitted through our website at legalaidmke.com. And then I guess the third thing I'll mention is that we are one of the co-partners in the Rental Housing Resource Center. We have staff, we have paralegals that staff the Rental Housing Resource Center. We're currently working on a tenant training. It is intended to be a class, online class, videos, online materials that a tenant can go through and get a certification, which we're hoping we get some buy-in from some of the landlords, the apartment association, to try to help people who have perhaps faced an eviction or have a questionable rental history, in order to give them a little bit of a chance to rent apartments again from more reputable landlords than the ones who will currently rent to people with eviction histories on their record. So that is the broad overview of what we do at Legal Aid. Let's see, Emily has. Someone shows up to court without representation. There's not a lot that's going to happen. The courts are probably not going to stop the proceedings or stay the proceedings to allow them to go get an attorney. Might be worth asking, but there's a reason that we stopped calling it the right to counsel program, because it's technically not a right to counsel program in Milwaukee County. It is an opportunity to counsel. We will represent anybody, and we believe that there's funding and capacity for us to represent any eviction defendants in Milwaukee County who seek representation. But an actual right to counsel would require legislative changes in Madison, which isn't plausible. So short of changing the statutes in Madison, there isn't a literal right to counsel, but we are able to represent anybody who comes to us, preferably at least the day before, well, preferably many days before, but we're able to represent anybody. But no, the courts won't stop an eviction in order to allow somebody to go get counsel. I mean, I won't say it'll never happen. I'm sure that there are some edge cases where there's somebody so sympathetic or a landlord agrees to it for some reason, but generally that's not going to happen. Pandemic era protections have largely lapsed. I think the Maudwella this discussion about rent assistance is an example of some of that pandemic era stuff coming to an end. The state and federal moratoriums are long over. One thing that is still around is CARES Act 30-day notices. And this is relevant to subsidized housing, especially any housing touched by federal dollars, Section 8 voucher recipients. Technically, for if a house was purchased with a Freddie or Fannie backed mortgage, though that's tough to prove in a lot of circumstances. But any housing, any building touched by federal dollars has to give a 30-day notice instead of a 5-day notice under the CARES Act, federal law. That is quite frankly an accident. The CARES Act had a lot of provisions in it, including a moratorium, funding, and a requirement for 30-day notices for all federally touched rental housing. Well, somehow the 30-day notice provision was just the structure of the bill. It was accidentally, I'm not sure it's accidentally, but I suspect accidentally excluded from the sunset provisions of the CARES Act. So the 30-day notice is still in effect. There's a lot of solid law around the country. We have the small claims judge in Milwaukee will enforce that. There's a recent Supreme Court decision in Colorado, appellate decisions out of Washington State, but the strongest authority for the fact that the CARES Act 30-day notice provision is still in place is that a number of Republican lawmakers in Washington D.C. have introduced a bill to fix it. So it's pretty clearly the case. The exception to that 30-day notice, and again, this is only for federally touched buildings. The exception is that it only applies to termination notices for non-payment. So termination notices for cause, for non-rent breaches, for behavior, for lease violations aren't subject to the 30-day notice. Only termination notices for non-payment. I don't think that the fix is going to go anywhere, to be honest, but we're using our, I don't know. I don't know what ARPA is, to be honest. I'd have to look into that.
Do you mind if I read the question?
Sure.
Would the 30-day notice include any housing that is to be rehabilitated using ARPA, as a public entities program, or is this just specific to the CARES Act? Although you just stated legislators are looking to fix that language, just so everyone knows what the question was asked.
The CARES Act defines what is included, and it's fairly broad in that it's anything that receives federal money. So if ARPA is federally funded, I suspect that it would apply, and the 30-day notice for non-payment would in fact be required. But I provided my email address. If this is a burning question, I can look into it and see look through the definitions and make sure.
So this is Barbara. Have you seen a big upsurge in recent months as some of the protections that were in place during the pandemic have gone away? I mean, are you having a call volume that is beyond what you're able to handle?
The protections went away long enough ago that the surge is over and we're back to normal numbers. My concern is what happens when the ERA money at Community Advocates and SDC goes away, because right now a big part of eviction defense is working with Community Advocates and SDC to get rent assistance applications processed quickly and to buy time in court to get those applications processed. With that money going away, I'll tell you, the entire team, just about the entire team, maybe me and one other guy, have probably never practiced in a world in which the rent assistance money was not available. So it's going to change the dynamic a lot. It's going to change the business model for a lot of the landlords who right now are somewhat dependent on rent assistance, I think, just as a source of income. It's going to change the economic calculus for evictions with that money not being out there. There's going to be a real an adjustment period to see how evictions and just the housing market in general settles once these funds are gone. I don't know what's going to happen. I don't know how it's going to work.
Any last questions? I don't see any in the chat, so. Well, thank you very much. This is really difficult to keep up with all this information. It sounds like things change and you're keeping up with all the information. So we really appreciate your expertise, and to see how it aligns with all of our other speakers today is really interesting.
Glad to be
All
here.
right. Thank you. Next up is Christine Apple. Okay, so I'm going to take a few minutes to just reiterate the importance of our Karen Avery Forum that's coming up in a few months. Give me 1 second. So the Karen Avery Forum is an annual event that the Mental Health Task Force puts on, and we really try to get a deep dive into a specific topic so that we can gather as a community and see how we can learn more about the topic and advocate for resources for the topic. And then we have, at the end of the Karen Avery Forum, we have a call to action, something that we can all take away and go to either our agencies or to our elected officials and say, how can we help with this particular issue? Obviously, the big lead up to the forum is something we've talked about all day today, and it's housing. We talk about housing all the time and how it's necessary in order for people to receive further treatment, and we can see that we still have work to do. In addition to the information that we have at the forum, it's also a chance to recognize people who've done lots of advocacy work in our community. And so because of that, we have 2 awards at our Karen Avery Forum. One is the Karen Avery Award, and that is for someone who's done a lot of advocacy work for our community. We also have a Rising Leader Award, and that's to someone who's new to our mental health community, who's really energized in doing things that we want to recognize their efforts as well. The Karen Avery Forum is longer than our normal meeting. It's more towards 2.5 to 3 hours. And so because of this, and because of the fact that we need to gather usually a national speaker, we're asking for assistance for anyone who's willing to join our planning committee. We talked about that at the beginning of the meeting, but also just to reiterate, if you want to join, and if you're energized by the speakers today, please email Barbara Beckert. She put her email in the chat. It's Barbara Beckert at drwi.org. And we'll have more of a focus on housing. Usually we center around housing rights, housing resources, and you can volunteer in the chat as well, Barbara said. I like saying Barbara. It's like saying Madonna or Cher. Everyone knows who's Barbara is without using the last name. So we would love to have a diversity of thought, a diversity of opinion. It would make our forum just that much richer, but we're going to make sure we knock your socks off when we have our forum. Anything else about the forum, Mary or Mary's gone, or Barbara?
Thanks, Christine. This is Barbara. That was a great overview. I just wanted to mention as well that, this forum is called the Karen Avery Forum, and Karen, who was a longtime member of the Mental Health Task Force, was also a staunch advocate for housing. And she came to Milwaukee initially because of her role on the Fair Housing Council. And it's something that she really had a passion about, and that I learned a lot about from her. So I think it's really fitting that this will be the topic. And this is also the forum, and Christine may have mentioned, where we present our annual awards, including the Karen Avery Award. So watch out for those. It's a great opportunity to recognize people who do important work on housing in our community. And I think we heard from 3 outstanding advocates today. So I'm really grateful to them for sharing their expertise.
Okay, and so that's tentatively planned for the second. It will be the same date. Usually we have it the same date of our normal meeting, but the times are a little different because, like I said, we have a little more added to. So it may start earlier and end at 5, and but plan on having this in November. Barbara Beckert, she will be talking about policy updates, the state budget, and Milwaukee County Mental Health Board updates. Thank you.
Yeah, thank you so much.
Thank you.
We're going to move on now to some policy updates, and we wanted to start out by giving folks some information about the proposed budget for mental health for 2024. And I am going to try and share my screen here. So just give me a minute, please, while I get set up to do this. Ooh, the document is right here that I want to share. So just want to share screen. Well, I hope that you are currently seeing the mental health, Milwaukee County financial health. Is that what folks are seeing? Thank you for nodding, Christine. So this is an overview document from the Milwaukee County Mental Health Board. And I think people probably aren't surprised to hear that this is going to be a very tough budget year for Milwaukee County. It feels like each year it gets more difficult. And of course, part of it will determine on what happens with the state budget, which is still a work in progress. So right now, behavioral health services has been given in the budget jargon a flat levy target. And I guess the good news about that is that it's not going to be cut, or that's not what's being anticipated. And in part, that's because there's language in state statutes that has a floor for what the tax levy can be. So these are the things that they plan to prioritize in the budget as proposed. Access, investments in provider network, prevention, trying to help people on the front end, and staff support, including racial equity training and implementation. So these are the new budget initiatives that have been proposed for 2024, and we wanted to share these with you. There's still an opportunity if you want to weigh in and send your comments to the Milwaukee County Mental Health Board. And of course, Mary Neubauer represents the Mental Health Task Force on the Mental Health Board. So she's always a great contact to reach out to as well. So there's a plan for new internal peer support staff to support crisis mobile. These would be peer specialists who actually work for Milwaukee County. There's a plan to have a provider rate increase for our community support program, or CSP, that provides the most intensive level of support. And I suspect that there hasn't been a provider increase for some time. There also is a funding proposal for CSP in the state budget that we'll talk about in a minute. A suicide prevention coordinator position. We all know that there's sadly in recent years been a significant increase in the rate of suicide attempts and completed suicides. So this would be a position to provide more work to address prevention on the front end. Some new internships to support long-term workforce development. The workforce challenges are something we hear about every day. Non-emergency medical transport services. These are folks who are now transporting people from the mental health emergency room if they're being admitted to the hospital or going to the crisis resource center or to other places. So this is folks who are specially trained, but it is not a law enforcement transport. So that seems like a positive thing. Often in the past, law enforcement had to provide transport to the hospital. And then some additional administrative positions. I don't know any detail about what that means. So some of the unknowns, unsure about the impact of the opioid settlement funds, the state budget, as we've just been talking about, a lot of uncertainty there. So the Mental Health Board has had a few public input meetings. Unfortunately, one of them is taking place right now. It started at 4:30 and the meeting notice only came out yesterday. So I was disappointed there wasn't more of a heads up about that in advance of the meeting. And there's going to be another opportunity on June 22nd. So if you are on our listserv, you will receive that information. So I'm going to stop the share and just check for a minute to see, does anyone have any questions regarding the county budget and the process for input? We do historically at our August Mental Health Task Force meeting have a briefing on the county budget. And that is what we're expecting to do this August as well. So stay tuned. There'll be an opportunity to hear more. And that will focus on a number of different areas, health and human services, transportation, the jail, the House of Corrections, which is now called by a different name, and a few other areas as well. So that'll be a chance to get up to date. All right, well, now we are going to move on to the state budget. And as some of you may have seen, we had sent out some information earlier in the week. This is a very big week for the state budget. So today, the Joint Finance Committee met in Madison, and they're making decisions on the Department of Public Instruction budget and the transportation budget and the shared revenue package, which will have a lot of impact on Milwaukee County. That's been a very difficult process, but I guess we'll know soon what the committee had voted on, then it needs to go to the full legislature. In addition to that, this Thursday, we are going to have the Joint Finance Committee voting on mental health services in the budget. And they will also be voting on the Department of Children and Families, DCF. So that's a really big day as well. So this is an important time to be contacting your state legislators and asking them to ask the Joint Finance Committee to invest in mental health in the budget. And you may remember how we had a rally, a press event that Independence First hosted that was held a little bit earlier in the spring. And that was held in May, and that focused on some advocacy for the budget. So I'm just going to bring up the action alert that we had then, just to remind you about what you might want to do to take action now. So I will share my screen here. And let's see. When you have multiple monitors, sorry folks, it just gets a little hard to keep track of everything. There we go. All right, so just a quick overview of what you might want to do to contact your state representatives. So the folks you want to contact are your state assembly representative and your state senator. You can find their contact information on the state legislature homepage under Who Are My Legislators. So you just enter your home address there if you don't already know who they are. And what I would suggest is to call or email them and do it as soon as possible and ask them to invest in mental health services in the state budget. One thing that people sometimes suggest is call them in the evening, because then you can leave a message on the answering machine and you can talk for as long as you want and it will be there waiting for them. If you rather not talk to a person. If you'd like to talk to a person, call during the day and you'll probably get a staff person. So you want to introduce yourself, make sure they know where you live, that you live in their district, because they want to hear from constituents. If you have a job that's relevant to mental health or disability, let them know, and then tell them why the issue is important. We've got a few different issues in the state budget on mental health that you might want to mention. Increased funding for peer recovery centers and peer-run respites, addressing the need for improving access to mental health services for people with hearing loss. There's a budget proposal to fund a new program to coordinate training and supporting mental health substance use disorder service delivery for people with hearing loss. Supporting room and board expenses for Medicaid members seeking residential substance use disorder treatment. The fact that those services are not paid for right now is really a barrier for people who need that support to deal with an addiction. Funding for the Medicaid Community Support Program, funding the county match. If this happens, that could be a really positive thing because it will free up the dollars the county currently needs to provide to fund that program, and they can be used to fund additional services. So it would allow services to expand. The ORS program has already been voted on. And some of these other programs are in other budgets, either DPI or DOC, so we won't mention them. Suicide prevention efforts. That's something else that they will be voting on tomorrow. So that's kind of a quick walkthrough of how to take action on the state budget, and we will send an email to follow up after this meeting to give you those talking points so you will have them at your fingertips. But any questions or comments regarding the state budget? All right, Denise, did you want to comment at all? I know you've worked really hard for the deaf and hard of hearing mental health services initiative.
Yeah, this is Denise. I really, it's been kind of quiet about that topic lately. So I'm not exactly, you don't have a real recent update, but there have been several words, terms, just hearing loss. We have the deaf community prefers not to use that term. I understand from a federal perspective, they still use it, but we are trying to shift our perspective because hearing loss, just to give you a few examples, if I'm born deaf, I've never lost anything. I've never lost my hearing, so to speak. So just to throw that out there, because, you know, so I was born with it. So for those who are hard of hearing or late deafened, or seniors who have lost their hearing because of age, that concept of loss makes sense, but it doesn't apply to all of us in the deaf and hard of hearing community. So just throwing that out there as a little tidbit, but so far it's been kind of recently fairly quiet for this group. So I'm not exactly sure where they are in terms of the legislative funding, but I haven't heard any recent updates. But if somebody else hears, feel free to pass it along to me. That'd be great.
Okay, thank you. Always appreciate the education you provide for us, Denise. Well, that's the wrap up then on the state budget and the Milwaukee County Mental Health Board budget. And again, encourage people, take action now on the state budget. We'll get an action alert out to you yet this evening, and the vote will be on Thursday on mental health items in the budget, but don't wait till Thursday. Take action as soon as possible and let your legislators know what your priorities are. So thanks everyone for your advocacy. Thanks to our speakers, and I will turn it back over to Christine.
Thank you very much, Barbara, not only for the information, but for also making it very easy for us to act. I think sometimes we say advocate, we don't know what to do, but you made it very easy for us to be able to know what to do and say and contact. So just to add one thing to that, the governor said this is a year of mental health. I hope this isn't the only year, but the time is now. I think people are listening, including our governor. And I just want to thank all the speakers today, very informative, and it's a great resource, not only for us, but for the people whom we serve. And I'm going to be using some of these resources after today, some that I didn't know about. So thank you for your time and information. The only thing I want to end with is please join us in July for our mental health task force meeting. I think I can confidently say that we'll be having speakers on peer delivered services. So I know that's not 100%, but I think I'm 99% sure that's going to happen. So it's a big deal, and we want you to be there. So please join us second week in July.
And we'll also have speakers from Grand Avenue Club talking about employment and about the clubhouse model. So great information about employment too.
Okay, thank you. You get a few minutes of your day back. We'll see you in, and please email if you want to join the committee for the Karen Avery Forum too. Don't forget about that. Thank you. Bye-bye, everybody.
Thank you.